With this roadmap, the four-stage plan, so much of it hinges, doesn't it, on what the magical number will be when it comes to the vaccination rate?
Well, certainly. I mean, obviously, the vaccination is the key to our ability to be able to open our borders up again and get Australia back to whatever the new normal is going to look like. So, clearly over the coming months, it's really, really important that we get the vaccine rolled out, that we make sure that people have confidence in having the vaccine so we can get our population vaccinated to a level that will allow us to do those things that we've talked about in stage 2, 3 and 4 of the plan to get Australia back to normal.
While we're talking about reopening, do you feel for those Australians stuck overseas, they can't get home, given in the short term the leaders have agreed to, in fact, slash the number of international arrivals?
Well, of course, we've been trying to repatriate every Australian who is stuck overseas, but there have been obviously a number of challenges that still remain. But right now, because of the impact of the Delta strain, which is obviously much more virulent than anything we've seen before, we are focusing on the health aspect. I mean, by focusing on the health aspects at the start of this pandemic, we were able to get Australia through that first stage and get our economy back open, and we've seen the results economically over the last 12 months. So right now, obviously, our focus has to be on dealing with this Delta strain, getting everything back under control again so we can focus on the economy. It's served us well in the past, and I'm sure the quick and effective action of our health officials, and we'll see that we'll come out of this pandemic or this current lockdown as quickly as possible, and then we can refocus on getting Australians home and getting our economy open and getting our borders open again.
How long do you think we'll have to wait before we get to stage 4 and things are back to normal, or are we talking years?
Well, I mean, obviously this all has to be predicated on the medical advice and the work that currently the Dalhousie Institute is doing about making sure that every stage of the pathway back to opening up Australia again is one that takes into account the health and safety of Australians, as well as obviously focusing on our economic conditions here. But, obviously every Australian wants us to be able to get to stage 4 as quickly as possible, but we can only do that if we know that the health and safety of Australians has been protected along the way. So we'll have to wait for the medical advice to come in and all the other advice to come in. But, like you, I hope that the borders are open as soon as possible and we can get on with our lives.
Anne Ruston, this week, Daniel Andrews, or the week just gone, Daniel Andrews said basically it would be unreasonable to have lockdowns on the basis of protecting those unwilling to protect themselves, i.e. when we get to a clear majority, 70 or 80% vaccinated, that then we have to start reopening. That's a reasonable proposition, isn't it? That people, if you're not going to get a vaccine and not willing to take that step, that the government, that the nation, that our society has to be done on the basis of people actually taking the vaccination when it's on offer. Do you share a similar view?
Well, look, the first thing I'd say is to anybody out there that has vaccine hesitancy, go and see your doctor, have a discussion with them and find out if there's a pathway that's going to suit you to get yourself vaccinated, because we want every Australian to be vaccinated. But there will become a point in time where enough Australians are vaccinated that we are able to open up our borders again, and our medical and health systems will be able to cope with those people that will inevitably fall sick, because we're not going to see COVID-19 go away anytime soon. We're just working on a process to be able to live with it. But I think first and foremost, I think we have to make a really, really concerted effort to convince those people that at the moment are not considering having the vaccine, for them to reconsider that. And as I said, the health advice is the strongest argument that we can possibly ask you to consider in getting vaccinated.
The WA Premier Mark McGowan had this to say off the back of the National Cabinet when talking about having lockdowns as last resort. I want to play this comment and then get your thoughts on it. Let's hear Mark McGowan during the week.
Last resort, as Peter said, is subjective. It is subjective. New South Wales' version of last resort is get 80 cases and then you have community spread and a lockdown that might go for weeks and weeks, if not months. Our view of last resort is that you listen to the medical advice, you see if there's any prospect of community spread and try and kill it quickly and efficiently right then, rather than let it drag on and result in potentially catastrophic consequences.
Are you worried that some premiers will, even when vaccination rates are high, will continue to use lockdowns even with just a couple of cases?
Well, I mean, obviously the decision that was made at National Cabinet on Friday was to avoid having to have lockdowns because there would be sufficient people vaccinated to enable the health systems in our various states and territories to cope with any people that became infected. So I would hope that all states and territories would abide by that, because inevitably it's the people of that particular state and territory that become the victims of the lockdowns. And of course we understand there are times and occasions when you do require lockdowns, but they come at a big economic cost. They come at a big social cost. They come at a mental health cost to the people who are living in the states and territories that are in lockdown. We've only got to look at the trauma that was caused to many Victorians by the amount of last year that they spent in lockdown. So I think we do need to be using lockdowns very, very sparingly and only using them as an absolute last resort. But the pathway that was charted on Friday, I think, is a really important and positive move, and it can give Australians confidence that there is an outcome. We'll be working towards that outcome, and hopefully the territory and state premiers and chief ministers will abide by that and play by the rules of the plan that they agreed to on Friday.
Should the government, in hindsight, have acquired more vaccines? Given what we've said about it basically underpinning everything in terms of this roadmap, in hindsight, would you have bought more options?
Well, we did buy a lot of options of vaccine. The first and foremost, we thought sovereign capability of actually producing our own vaccine was tremendously important, and that was why we set up for the production of AstraZeneca in Australia. Well, unfortunately, the health advice has now changed on that particular vaccine, and it's now only highly recommended for those people over the age of 60, but it is still available to people under the age of 60 with the advice and their informed consent and their support of their doctor. But we bought a lot of vaccines, but this was extraordinarily uncertain times, and we now find ourselves relying quite heavily on the Pfizer vaccine. But we're starting to see, as of tomorrow, a significant increase in the number of Pfizer vaccines that will be arriving in Australia, and we have a trajectory for every Australian to have had a jab by the end of the year, or every eligible Australian, that is those over the age of 16. So we are now on a pathway to be able to fulfil our vaccine commitments. But yeah, look, it was uncertain times.
So you're confident it's turning around? You're confident it is getting back on track?
Well, I mean, you've only got to look the last 8 days. We've managed to get 1 million jabs in arms. It took us 47 days to get the first 1 million jabs in arms. So I think you look at the trajectory. Now with the increased dosages that are coming into Australia, there's no reason why we can't continue to increase the number of people that are vaccinated every day. I think every day last week we had a new record of the number of people that were vaccinated. So Australians can be confident that the vaccine rollout is well underway. 70% of people over 70 have been vaccinated, 50% of people over 50, 30% of the population have had a jab in the arm. So I think we just need to focus on the really good things that we're doing, and also focus on the fact that we've got an economy that is doing really, really well, despite the fact that we've had the most extraordinary sort of shock to our economy since the Second World War.
Is the federal government optimistic that the New South Wales lockdown will end on Friday as scheduled?
Well, certainly listening to the Premier from New South Wales, she seems quite confident that they're on top of it. My understanding is that the number of cases of community transmission, or people who've actually been out in the community, is dropping significantly. The people that they're now finding are people that were associated with clusters. I mean, obviously we all hope that we'll be able to open the state up on Friday in New South Wales, but of course, the uncertainty of this virus, I mean, the virulence of the Delta strain is something we haven't seen before. But, New South Wales have got a track record of getting these things under control, and I see no reason why they won't do it this time.
You've got, on another matter, a women's summit planned for later this month. The New South Wales government released an inquiry in the last week or so regarding coercive control. In fact, it was a parliamentary inquiry, multi-party. It found that coercive control should be criminalised amid a pandemic of domestic abuse. Do you agree with that? Should it be criminalised?
Well, look, I really thank the New South Wales Government. It was an amazing body of work that they've provided, and it will be something that will be discussed at the summit that's coming up at the end of July. But we know that coercive control and all the things that make up coercive control are often precursors to more violent behaviour in domestic and family violence. And if we are able to use laws and the legal fraternity to enable us to be able to get earlier access to be able to support people when we see these early signs of domestic violence, then that can only be a good thing. The other really good thing about this and particularly about the summit, is that about taking a more coordinated approach, making sure that the legal system and the specialist family domestic violence sector are all working together so that we can get a better understanding, so that we can get early intervention in place, because we need to stop the scourge that is domestic violence, and the best way we can do it is by prevention and early intervention, because we just cannot keep seeing the numbers of women who are hospitalised and sometimes tragically killed at the hands of an intimate partner. It is just unacceptable.
Well, we will talk to you in the lead up to the summit on July 29 and July 30 and cover that very important meeting and hopefully some significant outcomes from it. Anne Ruston, I appreciate your time as always. Thanks.
Thanks, Kieran.